Welcome. Good evening. It is 7 p.m. and we will begin our webinar celebration for International Women's Day. Welcome and thank you to everyone for joining us this evening. I am your host. My name is Patty Soriano Guzman with Montefiore Nyack Prenatal Center in collaboration with Community Education. This evening, we acknowledge and celebrate International Women's Day. Choose to challenge. We welcome all women of all ages and stages and walks of life. It is essential that as women, we recognize our challenges and have a place to go where we can release and recharge. We invite you on a journey of self-awareness, self-appreciation, and self-love as we shift our mindset on what it really means to take care of ourselves. With that, I will introduce our first guest, Yvette Leonard. Her practice, Attentive Heart Coaching, draws from a rich tapestry of modalities for listening to the mind, body, and soul, integrating the influences of psychosynthesis, medical qigong, and mindfulness, contemplative movement, and biography and social arts. Yvette brings a deep and sacred respect for slowing down and observing what is going on within us so we can choose how to respond rather than react. Her work with clients supports a process of self-discovery and looks forward to collaborating with you via Attentive Heart Coaching. Thank you, Yvette.
Thank you, Patty. Thank you for having me here. It's an honor. And good evening, everyone. I'm so happy to be celebrating International Women's Day with you in the middle of the pandemic. Welcome to my Zoom studio, and thank you for welcoming me in your space. Being able to generate well-being and resiliency in the midst of adversity is all that Radiant Lotus Qigong is about. I would like to dedicate this short demo to all of you who are watching and may have lost a loved one. So may you find some healing. And to all the women and men who are fighting this virus and who are choosing to work in a collaborative mode, especially in our local hospital, Montefiore Nyack, to the house cleaners, to the secretaries, the administrators, the technicians, the nurses, the doctors, my deepest gratitude. When, I'm gonna pause here, take a little sip of water. When we live under fear and face danger, our vagus nerve sends messages to a part of our brain that is only concerned with survival and protection. And after danger has passed, it may continue to send this trauma response. Now, science points out that the shaking that animals do after danger has passed benefits us too and resets our nervous system from fear, away from fear towards well-being and safety. So in a little while, I'm going to turn some music on. And if you want and are able to, I invite you to stand up and begin shaking your body in any way that feels good to you. Shake your hips and shake your shoulders and your wrists, and then we'll continue from there. Qigong recognizes the medicine is in the body, in the shaking. So if you want to join me, please stand up. I'm gonna put some music from the country where I was born, Brazil, and we will shake our bodies in a way that's pleasant to you. Away from the screen. Okay, wonderful. Wonderful. So just find a spot. Just find a spot and feel your beating heart if you have shaken. And I'm going to now proceed. We're going to go through a cupping technique. We're going to use the palm of our hands like a cupping to draw out toxins. When you bend the middle finger and put them here, this is the Laogong point. So we're going to use it as a cup. So just let your arms fall to the side. If you bend one arm, the place where it touches here is your thymus gland. And in order to strengthen immunity, we could begin tapping either with a soft fist called the tiger's fist with the knuckles. I'm going to begin tapping. Yeah. Wonderful. Thank you for turning the camera on. It helps the energy. Yeah. And now, remember, if you have had issues with your tissues, you want to be very gentle with your cupped hand, and you want just to send warmth to your breasts, because women accumulate stress around her breasts and reproductive organs. So cupping your whole breast with gentleness. Nice. And we do now the armpit. We're moving the lymph nodes, the fluid. Now the rib basket, I don't like it to call the rib cage. And you could sigh out. Let your day, just the worry and stress from your day, just ooze out. Under part of your arm, biceps, forearm, just cupping, wrists. This sends signal to our brain to produce calcium, and relaxing your shoulders. Just give a hand to yourself for showing up here for self-care. Yes, back of the hand and wrist, outside of the hand, and you could support the other elbow and do it this way. Nice, gentle and caring, beautiful. And now with a lot of awareness, we're going to switch hands, aware that the other hand is going to tap the thymus gland, and begin on the other side. Good. Releasing toxins. Excellent. And really putting the hand on their hips so you could access the whole breast. Even if the breast is not there, the energy, you're sending love. You're just, if you've had issues with your tissues. When we do this consistently, there's a change that you begin to notice. Under the armpit, notice that I'm supporting here. Good. Rib basket and sighing out. Nice. Under part of the arm, biceps. Tapping and cupping. Again, the wrists, the hand, giving a hand to yourself. Back of the hand, wrist, outside. Good job. And you could tell yourself, good job, yeah. And now we're going to glide our hands here. Under your clavicles is the 2 lung points. During the pandemic, we really want to access that. So cupping and sounding your voices. Ah, really feel your breath in your throat, in your chest, in your lung, and then slowly coming to your breast. This is the part that you could choose to cup them and stay here, or do a little paddling up movement. Feel your heels gently bouncing on the floor, and you could even turn away from the screen and enjoy. Close your eyes, really enjoy. Sometimes we only address our breasts when there's issues. This is for self-care. Beautiful, yeah. And now slowly coming to the belly and the liver and the spleen and the large intestines and the womb and the ovaries, even if they're not there, are receiving a nice vibration. Good. Belly's relaxed like a Buddha belly. Feel it, hands are relaxed. Yeah. And now coming slowly with little raindrop fingers to the pubic crest. Feel the bone there. We're going to hear after, we're going to see the pelvic structure. And now accessing the inguinal lymph nodes and paddling with a cupped hand, really making sure that your belly button is pushed towards the abdominal wall, so you have lots of spaces and it's not painful. You begin to paddle down. Nice. Nice little massage, cleaning the meridians, coming to the malleola, around your toes, and coming up the outside of the legs. Good. Behind the thighs. Nice. Arms are relaxed, and now your glutes. Really have them come to your hand. Yeah, nice. Beautiful, beautiful. Give your shoulders a little roll. And this way. And now, using your belly button as a motor, just toss whatever you don't need. Toss your problems, everything away. Your heels are coming up the floor. But little by little, see if you could keep them together and your hands, and just feel this nice movement. Feel the support of the earth. Feel the energy from the sky, and your feet and your head between earth and the sky, and letting your arms fall to the side. Beautiful. See if you could feel a little tingling on your Laogong point. Nice. Okay, we're going to continue now. Any Qigong we do, Qi means life force, Gong means practice. Qigong is known as medicine in motion, but it only works if we are plugged in with our mind and body aligned. And this is called vertical alignment, and it works just like when we plug our phones to an outlet. We're going to use a very sustainable outlet available for us all the time, earth and sky. Now, on the soles of your feet, between the two balls, you have where there's a little divot. There's this point called kidney 1, okay? It's called the bubbling spring. How lovely is that? And it's a kidney 1 point, and it helps to bring the energy from the earth and circulate it towards your body. So slowly lower your eyes, and then lift all 10 toes and spread them in the earth like the roots of a majestic tree that you are. And just relax in the support that Mother Earth gives us all the time. Now I'm going to send imaginary roots feel rooted. Send the roots all the way down to the core of the earth through that bubbling spring point. And then with a smile and gratitude, pull with your mind 2 columns of blue energy through the soles of your feet like 2 straws. Feel the energy coming up and dissolving inflammation in your ankles, in your calves, in your knees and thighs. Feel it entering through your genitals and feel a nice breath now in your belly. Feel warmth in the front and in the back. And now continue to pull the energy in a space between your breasts, the middle dantian. Women have all these power places. And again, a little inner smile, breath, and space. And then continue to pull this light and feel it on your throat. This is just like the chakras. Feel breath in the front of your throat and in the back of your throat. And then pull up the column of light in between your eyes, third eye, crystal palace, and feel the expansiveness in the front, in the back. And then hover above the soft point when you were a baby called fontanelle, the Bahway point, and like there's an invisible strings pulling you towards the sky. Send that energy to meet the energy of the sun, the moon, and the stars, and maybe visualize your own guiding star, giving you purpose and direction. And from all the way up there, shower down blessings in the form of golden light, retracing your path, entering through the Bahway point. Feel it inside your body, third eye, and then the throat, and then between your breasts, the middle dantian, your belly button, your dantian, genitals, feel it going towards both legs, down again, bouncing back up, and then you have one hand in your dantian and one in between your breasts. And slowly open your eyes, aligned in neutral compassion. Now glide your hands towards your dantian, your belly button, placing both thumbs, doing a triangle, and just let's feel the breath, this wonderful place called the uterine palace. Now, some women have had ovaries or uterus removed, and we can still connect to the energy. Neuroplasticity tells us that our brain has the capacity to open pathways. So smile to this place and see if you could feel the breath. Inhaling, exhaling softly. The place where your fingers are is the signature of the ovaries. I'm going to call this place a sacred place. It not only produces life, but it's a place of creativity. So I bet your hands are warm right now, and have them now face each other and see if you could feel this chi that you've generated between your palms. And now that we know our two allies, bending our knees, turn the hands towards the earth and then extract energy. We're going to go into a movement called Phoenix balances her wings. This restores your auric field if you're drained and overwhelmed. Can you see her opening and closing her wings? Feel the energy. Inhaling, exhaling, pulling the energy from the earth. Knees are bending. And now the phoenix is going to she's going to spread her wings. Ah, feel the support in your shoulder blades. Eyes are soft, gaze is soft. And now we're going to bend, we're going to be in relationship with the living earth. We're going to bend and we're going to pick up the energy. We're going to cross our arms. We're going to come bend again to this lung point. And we're going to massage it. And sometimes grief emerges or any unwanted emotion. So just be with this a little bit, massaging, then using your hands like we did before, like cups. Decide just for now to release what you don't need. So inhale and pull it out. Cross your wrists, bring it to your third eye, deciding just for now to clear your mind. Turn your palms towards the sky, reach for support, and see your auric field in the form of a rainbow. I'm going to do this part again. Inhale, exhale, and massage the lung points gently with your fingers. From the point between your heart, when you decide, it's time now to release what you don't need, to clear your mind, to reach for support, and to cleanse your field. And one last time, you could do this any time of the day if you're overwhelmed, just sitting on a chair. Inhale, exhale in place, and release. Inhale, clearing your mind, exhale. Good, very nice. And now we come back again to this place that is just like a garden where we can plant seeds and when flowers can bloom. And we know that the lotus grows in a pond, in a muddy pond. And maybe you've heard the sentence, no mud, no lotus. This is spiritual work, to choose to address hardship and to rise from it. So we know that a lot of us carry epigenetic stress. It can be transmitted through generations in your body. Think about it. You and I, we were seeds in our mother's ovaries long before we were born. We also know, research has also shown how this epigenetic stress can be encoded in our bodies for generations. And many of us carry this generational trauma, whether it's the effect of systemic racism on Black and brown people, or violence against women, or the effect of war. There is a way out of it. And I was so inspired this year in the inaugural address by the 20-year-old poet laureate, African-American poet laureate, Amanda Gorman, when she said, she challenged us, this is our hashtag this year, she said, being who you are is not just what you inherit, it's the past we step into and how we repair it. Radiant Lotus Qigong invites this repair of generational trauma in our bodies. And I'm going to show you this invitation right now. So you could follow, and we'll do this twice. So here is our pond and this capacity, this mud that we have this adversity and hardship. We're going to open the first petal of the lotus by inhaling and moving shoulder, elbow, wrist. I'm going to look at our past, what has been encoded in us, acknowledging, and then moving our shoulder. We're going to exhale and release it in the present time, touching the solidity of the earth and open to inspiration from the cosmos. We inhale and circulate that, turning our fingers back and watching that, circulating that. Palm is turned for support. We reach the sky and we bring that support back to us. We'll do the same thing with the other petal. Maybe what's been encoded in your left side, your mother's lineage. So inhale, look at your past, now release it and repair it by touching the solidity of the earth, open to inspiration of the cosmos. Inhale, circulate that support, palm is turned up, rise and bring it back. And now we acknowledge, we open both petals, acknowledging our capacity to transform through this hardship. So let's open, inhale. And exhale, we jump into our creative process and touching the solidity of the earth, opening to inspiration. We circulate that. And now I'm going to see a heart. I'm going to both, here's the lobe of the heart, and we trace it. One more time. Inhale. Exhale and dive into the present. Inhale. Turn your hands back. Circulate that. Palm is turned up. Here's the heart. Can you see it? Exhale. Full heart back to your sacred center. Now, not everything in a Qigong class is just this flowy movement. We have movements that address real medical issues, bladder support, which we'll hear in a very short while, PMS. We have beautiful movements like snake walk, and we learn how to stabilize both sides of the brain by moving our hands this way. So right now, please take a seat, and we're going to rub our hands together. Thank you for generating this chi together. And we're going to place them over our eyes. They're always under stress. And release, feel your eyes relaxing like two full moons. The back of the eyes relaxing. Can you feel the heat? And now let your palms hover over your face, and let's really palm our face, giving ourselves a delicious chi facial. See if you could trace the heat. 1, 2, and 3, and the other way. Relaxing your jaw, your tongue, space between your teeth. And then with fingers, I'm going to begin tapping a little bit our neck, endocrinal system, thyroid, tapping under her mouth. Not pokey, just really gentle. Smiling inside, relaxing the eyes, coming to the base of the nose. We do a whole sequence, and then tapping your forehead, the temples, and going behind the occipital ridge. And then we're just going to close now, tapping our hair, Oh, that feels good, doesn't it? And again, gliding your hands now to your heart, to your dantian, and giving yourself a nice chi hug and opening up to everybody. Really feeling this collective hug. It's so wonderful to see so many of you. I hope you've got a little taste of Radiant Lotus Qigong. You are warmly invited to try for free one of my 2 online classes that I offer. And again, a lot of medical issues are addressed. And I will leave you with a saying, uh, the body heals with play, the mind heals with laughter, and the soul heals with joy. And I trust that collectively we could generate this energy together, um, and benefit everybody. Um, so again, my practice is attentive heart coaching, and I'm certified by Daisy Lee and by Deborah Davis. They're both women Qigong teachers. I learn personally with them, and I am so happy to share this with you tonight. And thank you, Patty, for your leadership and your initiative. And I'm excited now to listen to Dr. Loney, what she has in store with us. Thank you very much.
Thank you, Yvette. That was delightful. And I hope everyone enjoyed it and will be visiting you soon. Next, we would like to introduce Dr. Lonnie Hirsch, founder and owner of Peaceful Pelvis Physical Therapy in Nyack. We are so pleased to have you here with us. Without further ado, we will start our next portion of our event.
Hi, everyone. Good evening. Pleasure to be here with all of you tonight. Patty, thank you so much for organizing this. This has been wonderful. And Yvette, that was so much fun and so relaxing. I love the tapping and like the tingling sensation. I hope everybody felt that doing it at home too. For those of you who have your cameras on, thank you. It makes it more fun than talking into the black abyss of Zoom. So if you feel comfortable turning on your camera, please do so. And we're going to jump into this next portion. So I'm going to share my screen. Bear with me one moment. Okay. Alrighty, so just a little bit more about me. Again, my name is Dr. Lonnie Hirsch. I'm a physical therapist, and I've been a PT for about 15 years, a little bit over 15 years now. And about 2 years ago, I started my practice in Nyack, which is Peaceful Pelvis Physical Therapy. And women's health and pelvic floor physical therapy are really my passions. I had thought about doing this for a really long time, and I kept hearing more and more friends and family members saying, this is the kind of thing that I need. I need somebody who pays attention to these types of issues, and we're going to talk about what some of them are tonight. And as I kept hearing that, I kept thinking that there was really a need for this type of therapy, and that was what prompted me to launch my practice. So it's wonderful to have this opportunity tonight to speak with everyone in honor of International Women's Day. And we're going to jump right into this because this is a topic that really is applicable to everyone, regardless of age. And even if I don't know if there are any men joining us tonight, but this is applicable to men and women because I feel like it's applicable to all women. And for men, there are women in your lives who need to know about this information. And sometimes somebody else is the one to mention it. So it's really relevant to all of us. Okay. All right. So first of all, the question is, what is women's health physical therapy? And I can't see the chat box anymore now that I'm sharing my screen here. But if you want to type in, I'm kind of curious to know if people are familiar with women's health physical therapy, or if this may, for many of you, be the first time that you're hearing about it. So basically, women's health PT is a way of optimizing the way that our bodies work, but really taking into consideration all of the changes that happen throughout the lifespan, from the time we're young, initially going through puberty, and all the way through menopause and everything in between. So like I said, it's applicable to all of us. And a major focus of women's health physical therapy is pelvic floor rehabilitation. And we are going to talk about what that is. Patty, did we get any responses? Are people familiar, not familiar? Nobody brave enough to put themselves out there? That's okay, we'll move on. Okay, so first question, what is the pelvis and what is the pelvic floor? So the pelvis is literally that structure in the center of our body that's pictured here. And it basically attaches our upper body to our lower body. So super, super important. And if you put your hands on your hips, that's where your pelvis is. Okay, we all have a pelvis, even men. Sometimes people think it's funny when I talk about this and I say, no, men have pelvises too, but we all do. And there are some main jobs of the pelvis and the pelvic floor. So the first one is to provide support. Inside the pelvis, we have our pelvic organs. Sometimes some of them have been removed for various reasons, but the pelvis holds organs there and has to hold them up properly to do the job. There's also a sphincteric function where the openings have to be able to open and close at the appropriate times to allow for urination, for bowel movement, and for sexual interaction. And additionally, these muscles are really important for sexual appreciation. And when they're worked well, they can contribute to more intense orgasms. So to better tune into where these muscles are, I want everybody to do a little coughing activity with me. So if you're sitting in a chair, I want you to go ahead and cough, okay? So you can either cough or you can clear your throat, do a little one of those, and feel what you feel in your seat, okay? When I do this in person, I like to get some response, but I'm gonna tell you what you might feel. Usually when you do this, you feel some downward pressure, a little bit of pushing downward into your seat. And if you feel that, that is your pelvic floor. When you cough, when you sneeze, laugh, any of those things, it causes pressure from above, puts pressure down on those pelvic floor muscles, and they give a little bit to allow for that. But now I want you to do it again. And this time you're going to do what you might think of as a Kegel, if you've heard that term, or a pelvic floor contraction, kind of squeezing those bottles like you're, the muscles rather, like you're stopping the flow of urine. So go ahead and give a good squeeze. And then cough again or clear your throat again while you maintain that squeezing. Okay, what you should feel this time is that there's less of that downward pushing, because if you do that Kegel, that pelvic floor contraction, you're giving support. So those are the muscles that we're tapping into. And these are muscles that oftentimes we don't think a lot about. And if they're working well, we think even less about them. And then when we have problems with them, they kind of become, super important and a big focus. But it's an area that we really should all be paying attention to. And it's something that we can train. That little squeeze before we laugh or cough or sneeze is really important to make sure that we're not leaking. And if we don't do that consistently throughout life, sometimes that can put us at higher risk for bladder leakage down the road. It's kind of like when we cough or sneeze and we do that into our elbow. It's not something that we did as a child. It's something we had to learn. And just like we can learn to cough into our elbow, we can learn to squeeze these muscles and use them effectively to support what's necessary. All right, so we're gonna move on here. Okay, so who should care? Everyone should care about the pelvic floor. And the reason for this is because, like I said, it's applicable to everyone. If you are, I'm gonna give you a whole bunch of different things that this would impact. If you are a runner, your pelvic floor is affected by the pressure that the pelvic floor withstands when you run. If you lift weights, that is affected by the pelvic floor is affected by lifting weights, that pressure, that exertion. Being constipated over time can put stress and strain on the pelvic floor. So can having allergies, chronic sneezing and coughing, just like we were doing before. If we are constantly coughing, clearing our nose, sneezing, all of those things, all of that puts pressure on the pelvic floor. And additionally, of course, pregnancy and childbirth take a huge toll, as many of us know. And then for those of us who lift children, whether we are lifting other people's children or our own, lifting any weight, whether it's children, objects, anything like that, takes a toll on the pelvic floor also. Oftentimes, we are told that various things that we may feel, symptoms that we may have, are normal. And what I want to go into now is what is sometimes normal is, is sometimes common, but actually not normal. And what I oftentimes hear in my office when women come in is that they've voiced a concern to another practitioner and they've been told, oh, it's normal. It's normal with aging. Or, oh, no, that's normal because you had a baby. So that's kind of just the way it is. And postpartum, that's normal. And then what's even further bothersome to me is when women are told that surgery is necessary for some of these issues or that nothing can be done. And so what I want to discuss now is a couple of topics, and I highlighted 2 for tonight that I want to go over, that are actually very, very common, but not normal, and a little bit about what we can do regarding these. Okay, the first one here, oftentimes women will say, I look like I'm pregnant, but I'm not. Why is that? And this is not necessarily only applicable to women who've had a baby. This can be applicable to women of any age. Sometimes we see this for people who have chronic issues with digestive type of problems, irritable bowel syndrome, various problems that cause bloating of the abdominal area. There are a whole bunch of different things that can lead to this. And the truth is we can even see this in men. This is not exclusive to women, and we sometimes also see it in children. So the reason for this is because of a medical condition. It's not just that you need to lose weight or that you had a baby, so this is the way it is, but this is actually because of a condition called rectus diastasis. And it's pictured here so that you can see it. What happens with rectus diastasis is that the muscle in the center here, the rectus abdominis, which people think of as the 6-pack muscle, is supposed to be pretty close together, just maybe like 1 finger width apart there in the middle in a normal situation. But what happens over time with some of the conditions I mentioned, and then for sure during pregnancy, is that those muscles have to separate to allow space for whatever is going on behind in that abdominal wall. So if it's constant bloating, it's kind of over time pulling away to make way for that bloating. And if it's because of pregnancy, these muscles have to separate to allow room for that growing baby. That is a normal thing to have happen. It happens in every pregnancy. But what's supposed to happen is that afterwards, it's supposed to come back together or pretty close together. And if that doesn't happen, then we end up with a condition called rectus diastasis, which is what we see here. And this is really an issue of a weak abdominal area. And the abdominal muscles are part of the core. So sometimes people think of the core as only being the abdominals, and that's really not the case. We think of the core as the abdominal wall in the front, pelvic floor at the bottom, the respiratory diaphragm, which is right underneath the rib cage at the top, and then in the back, the spinal muscles. So it's really like a box. And every single part of that box has to be doing its job well for the whole system to function. And if that's not the case and any one part of that system is not working optimally, then something else is probably going to be taking the brunt of that and doing too much. So oftentimes people are not happy with having this condition because of the aesthetic part of it. And that's certainly a piece of this picture for many people. But another big part of this is that something else is doing too much. So with this condition, we oftentimes see chronic back pain. And it's not necessarily that the back itself is the problem, but the back is working overtime to compensate for this weak abdominal area. The same thing can happen with the pelvic floor. If the abdominals are not working effectively, the pelvic floor might be doing too much. And then over time, we might see leakage, we might see pelvic pain. There could be a variety of issues that result because of that. Okay, and I'm not going to go into a lot of detail about how this is addressed, but with women's health physical therapy and with pelvic floor physical therapy, there are very specific ways that we can make sure this is not getting worse, be able to manage what's going on behind it. If that's a pressure issue, for example, bloating, those kind of things, or just not managing pressure properly in the abdominal area, those are all things that need to be worked on to be able to correct this issue and gain better tension and strength in the abdominal area. Okay. The other topic that I wanted to bring to light here is bladder symptoms. So this is another area that is oftentimes talked about as being normal, and it's really not normal, although again, very, very common. Many, many women experience bladder symptoms. And when I say that, I'm referring to, it could be a number of things. It could be frequency of urination being increased, where somebody kind of feels like they're a slave to the bathroom, constantly running back and forth, always knowing where the bathroom is if they go out in public. There could also be issues of bladder urgency, feeling a really, really intense need to empty the bladder when there actually might not be a lot of urine there to begin with. And then, of course, there's also the issue of leakage. So leakage can be in a couple different forms. We can have incontinence, which is what we're referring to as bladder leakage, which can be urge incontinence, where you have to go to the bathroom so badly, but then you actually can't delay until you reach the bathroom. And then there's another type of incontinence, which is related to pressure. And so this would be stress incontinence. And that is what happens when a person is coughing, sneezing, laughing, blowing their nose, jumping up and down, maybe doing exercise, and they're not able to manage the pressure up above on top of their pelvic area and in their abdominal area, pushing down on those pelvic muscles below. So if that happens, then we end up with bladder leakage. So again, it's very, very common for women to experience this across the lifespan, really, but it's not normal. And there are things that can be done about it. And unfortunately, oftentimes when women voice this concern to their medical practitioner, they are told either that it's normal or that they need surgery. Sometimes women have surgeries to correct this. And if they haven't really addressed the underlying issues, that's sometimes when we see women with surgeries that have been considered to have failed. So we need to really make sure that we're addressing the muscle issues to really address this problem effectively. And I think, unfortunately, because it's such an embarrassing topic for women to experience this, it's something that we oftentimes don't talk about. It's not like a really fun or sexy topic to talk about bladder leakage, but many, many women experience it. And I think that if it was talked about more openly, it would certainly normalize it for people to be able to know that others are experiencing the same thing and be able to point women in the right direction to get the help that's really needed to best address this type of problem. So then, of course, the question is, well, what do we do, right? I'm just naming two main issues here, and these are by no means the only things that I see in my office that are very common but not normal. There are many other conditions that fall into that category. So I certainly don't want anybody to think, oh, I'm dealing with something else, and that must be very unusual because it wasn't talked about tonight. That's definitely not the case. Okay, but just in this, with the nature of keeping in mind time and everything, I'm highlighting these two topics. So the question is, what do we do about it? And the way to best address these problems, just like we would do with any other area in the body where there are muscles not working optimally or alignment isn't right, we would address those issues. And we need our muscles really to be both strong and flexible. So oftentimes people think, if they have a problem, let's say with their pelvic floor, for example, well, I have bladder leakage. I need to squeeze and Kegel all day long to really strengthen my pelvic floor. And that's actually not the case. And unfortunately, for many people, that can actually make the problem worse. The problem is that if we're talking about an individual, and everybody's so different, we're talking about an individual who actually has a pelvic floor that is really, really tight and does not relax. That is actually not a functional pelvic floor. We need our muscles to both be flexible and strong. So just for example, in my bicep, I need to be able to relax my arms so that my bicep is stretched way out, so that when I want to pick something up and bring it to me, I can contract my muscle and bend my elbow. But if I spend my whole day contracted like this, if I spend my whole day with my elbow bent, and then I want to go ahead and stretch it out, number one, it's going to be really uncomfortable and stiff. And number two, I might not even have the strength in this other range of motion that I don't use all day long. The same is true for the pelvic floor. We need to have flexibility and we need to have strength. And doing Kegels all day long, which is sometimes the first thing that a practitioner might suggest, especially if we're talking about bladder symptoms, can sometimes really make the problem worse. So Kegels are not the answer to all pelvic floor problems. So with other areas of the body, it seems pretty intuitive that if we want to get stronger or we want it to work well, we exercise it, right? If we want to have strong legs, we might join a class and go to the gym. And we do that in a group setting sometimes, right? We're at the gym, it's public, everybody knows we're doing it. We might be in a class kind of doing that in collaboration with other people, which makes it more fun. And unfortunately, with these types of issues, we don't necessarily think to do that in the same way, especially because the muscles that we're talking about and the areas that we're talking about are a little bit more intimate. We're not doing this necessarily in a public setting. And so I think, unfortunately, that's sometimes one of the reasons that women don't get the help that they need to address these types of problems. So as far as what to do, seeking pelvic floor physical therapy, seeking the help of a women's health practitioner is really the best thing to do for these types of problems in many cases, because we need to be able to address these problems in a really holistic way. And oftentimes surgery is not necessarily the first thing that needs to happen. And I always tell women when they call me and they say, my doctor recommended surgery, surgery is always an option. It's not going to go away, right? So if we can try to address some of these issues in a more, what's the word? A more relaxed way, a more conservative way, then oftentimes we are so much better for it, right? And if for some reason we try to address these problems and they don't improve to our satisfaction, we can always go back to our practitioner and say, yeah, you know what, I did all of this and I think I really might need that surgery. But I always say it doesn't need to be the first thing that somebody jumps to. So when we seek services from a pelvic health therapist, a women's health PT, these sessions are always done one-on-one, okay? Just like I said, we do, exercise classes in a group setting. But for pelvic floor physical therapy, it's not done like that. So it's not the same as being in a gym, in a physical therapy gym, where somebody is over here doing one thing and somebody is over there working with another therapist. This is in a private treatment room, and it's always one-to-one with the therapist. And then people always wonder, well, what happens in one of these sessions? So I just want to talk through that a little bit. When somebody comes into the office, we usually do first what you might consider as kind of a general physical therapy evaluation to begin with, after going through a really thorough history of the current issues and all the other medical history that has led up to the problem at hand. But after that, we go into a lot more detail about what's specific to women. So we're looking at posture and breathing. Breathing is really, really important for good functioning of the core. We're looking at the abdominal wall to check for that diastasis, to see if that's a problem, because that's something that we can feel for when somebody lies down and tries to lift up their head. Sometimes you might feel what's called a doming or a coning. It's kind of like a pushing upward through that space in the abdominal wall. And that's a good indicator that this might be a problem that you're dealing with if you've seen that on yourself. So we're checking for that. We're also looking for scar tissue. Many women have had either C-sections or other types of abdominal surgery, and those scars can really impact the way that the muscles are able to function. So we're looking at all of that. And then we're doing what's more specific to pelvic floor physical therapy, which is doing both an external and an internal vaginal exam. And people always say to me, oh, I didn't know that physical therapists could do that. But as a PT, we're really experts in dealing with the muscles and the musculoskeletal system. And so just like any other area of the body where we need to check the muscles, this is how we do this for the pelvic floor. So when we do this, we're using one examining finger, and we do an internal exam where I can really feel, can somebody squeeze and generate tension through that pelvic floor, but just as importantly, can they relax and let that tension go? Because like we were saying before, both have to be able to happen for a good functioning pelvic floor. But then not only is the strength important, we're also looking for coordination of these muscles, because it's great if you have a really strong pelvic floor that you can also relax effectively. But if you can't do it at the time that you intend to, that's where we end up seeing issues of leakage, right? If I'm not at the bathroom yet and I have a strong pelvic floor, but I can't contract it right now to be able to close off that opening, close off that sphincter and not leak, then I can't get to the bathroom in time because I didn't have the coordination of these muscles to delay. So by doing that internal exam, we can check for all of these things feel what kind of tension is going on in the pelvic floor, and then be able to come up with a plan as to how we're going to address those issues, whether it be through strengthening and really educating on how to strengthen these muscles effectively. And believe it or not, most women, when cued to do a pelvic floor contraction or a Kegel, they do not do it correctly. And it's really hard to tell on yourself if you're doing it properly. And not only if you're doing it properly, but if both sides of your pelvis are functioning relatively symmetrically, which they need to. And sometimes when we'll check this internally, we'll feel one side kicking in really nice and strong, and the other side isn't doing its part of the work. So all of these things are important, and those are things that unfortunately we can't check on ourselves. So we need somebody else to do it. And so, like I said, once we figure out exactly what's going on, then we can work on teaching the strength, teaching how to coordinate these muscles. And there are a lot of different exercises and ways to do that. And the way that I always like to do this, whether it's training the abdominal wall to get better tension through there, or the pelvic floor, is to really make it functional for women. Because I always say it's one thing to sit in a chair and squeeze your pelvic floor, and that's okay. That's important to be able to do, because we need to know that we can kick that contraction in and let it go. But we also need to be able to do it when we're up and moving. We need to be able to kick these muscles in and be able to stand up and use them effectively and give support in the front and support at the bottom. We need to be able to use these muscles really effectively if we're running or exercising. So we really try to train these muscles in all different positions so that it's not just sitting in a chair or lying on a table, but doing the things that we really want to and need to be doing. So I'm gonna skip there. Okay. So here are just a list of some other conditions that are very, very common, but again, not normal, and can be addressed with very conservative measures, oftentimes. So I just want to go through them here. Abdominal separation, which we talked about, that's the same as rectus diastasis. Coccyx pain is something that pelvic floor PTs treat. Sometimes people will have a fall on their tailbone many, many years ago, right? Like a lot of us have had that happen as a kid. And for those of us who have experienced that, we know how painful that can be. And it doesn't always resolve by itself or quickly. That can be treated. Constipation is also an issue that is sometimes very much tied into the pelvic floor. If we cannot let go of these muscles and relax the tension there effectively, constipation can be a problem. Incontinence we talked about. Painful intercourse can be another issue that's very, very common and not normal, but can be treated. And unfortunately, I think there's a lot of stigma with this, and people are oftentimes very embarrassed about painful intercourse. And so it's something that even women oftentimes tell me they don't even talk about it with their OBGYN, and it's not often asked. So it's really important that we kind of know for ourselves, and hearing this, that we share it with other women. And this is something that is not normal, but it can be treated. Painful scar tissue. I talked a little bit about this when I referenced the scar tissue in the abdominal wall, if we're talking about a C-section scar or another type of surgery. But an uncomfortable, tight scar, it's not just on the surface, it goes all the way down, right? If you had a surgery and they had to cut to get through to an organ below, that scar tissue is deep. And if it doesn't allow for good mobility of the tissue is not going to be able to work effectively. Pelvic organ prolapse is another one, which is basically just the descent of the pelvic organs, where they're supposed to sit nice and high in the pelvis in the right position. And over time, for a variety of reasons, sometimes they drop a little bit lower than they should and can cause discomfort. Sometimes people complain of vaginal heaviness, or people sometimes will describe it as the feeling of a tampon falling out. That would all be within the realm of prolapse. So if that's something that you're feeling, again, important to bring up to your practitioner, and it's definitely something that can be addressed. Pelvic pain, poor posture, sexual dysfunction, and then we discussed a little bit of the urinary urgency and frequency. Okay, so just a handful of conditions, again, all very, very common, but not necessarily normal. And I think oftentimes, well-meaning other women sometimes perpetuate the idea that certain conditions are normal. For example, if we have, sometimes an older generation that was even less inclined to talk about these issues than we are, sometimes say like, oh, you had a baby and, I had that too. And, that's kind of the way it is. Or, yeah, with age, I also had this, or my mother had this. And, it's in the family, and the sister had it, and it's okay. It's just kind of the way it is. You'll get used to it. You could wear a pad, those kind of things. And so I think sometimes women, in trying to sometimes normalize this in a way that it's not normal, and they're trying to make other women feel better about it, are not necessarily helping in terms of getting people to the right place to get the help that they really, really need. So again, common conditions, not normal, and many of which can really be treated very effectively with conservative measures. And so I would say that the take-home piece here is that we should all feel really, really empowered, that we have knowledge and that we have practitioners who can help us address these things in a conservative way. And the more that we can spread the word about that to other women, the better off we will all be. So with that, I will turn it back over to Patty. And I thank you again for all joining us tonight, and I'm happy to field any questions that you may have.
Excellent. Thank you so much, Dr. Hirsch. That was so enlightening.
Thank you.
Wonderful, wonderful information. And we had some comments that people, answering your question, that people are familiar with some of these conditions and what you're discussing here this evening. There is a question here. Is a referral needed to make an appointment with you?
No, not necessarily. In the state of New York, we have direct access. So a patient can decide on their own without a doctor's referral to be seen by a physical therapist for that first evaluation. And then we can actually treat for up to 30 days or 10 visits, whatever comes first. And then at that point, we will make sure to have reached out to the physician and have them sign off on whatever plan of care we've determined.
Excellent, thank you. If there are any other questions, we welcome them through the chat. Okay, there's a question coming. Okay, another question is, how do you know if you are doing Kegels properly?
It's really, really hard to know. And that's why it is my belief that every woman should be seen by a pelvic floor PT. It's fascinating to me that in other countries, in France, this is the standard of care. Everybody, especially postpartum, is seen by a women's health therapist because it's really not possible to know if you're doing it correctly, totally on your own. And if you're not doing it correctly, then there's no point in doing it. You might be making it worse, right? And even if you are doing it correctly, again, many women fall into this category of having a pelvic floor that is actually too tight. And if you are squeezing away trying to do Kegels, that is not helping the issue. So the best thing to do is really to be evaluated.
Excellent. Next question. Could the coccyx pain also be what can prevent someone from doing a sit-up because the area hurts?
It's certainly possible. There could be a variety of reasons, but when you do a sit-up, you're putting pressure directly on your tailbone, as you come up, especially if you're coming up all the way. And if you have had an injury there, for sure, that could be very uncomfortable.
That was a two-part question. The second part, also in connection to bladder leakage.
Yes, absolutely. It's a question that I always ask in my office when I do an initial evaluation. If there has been a history of injury to the tailbone, fall on the coccyx, anything like that, even remotely in the past in childhood, because it absolutely can be relevant to bladder leakage. That is a current problem. The muscles, I'm going to try to show you here. I have a pelvis here. I don't think it's going to look so clear because of my screen right now. All right, I'm not going to do that. So the muscles do attach to the coccyx itself. So some of the pelvic floor muscles attach right there, and when they contract, when they pull, they are pulling direct pressure on the tailbone. So if there has been an injury, or if that tailbone is not aligned the way that it's supposed to be, sometimes with a fall, it can get kind of tipped forward or to one side or the other, then the muscles will be pulling asymmetrically, and that can be very painful. And then the muscles are not going to be working effectively, and that can for sure cause bladder leakage.
Excellent, thank you. Next question is, how can one know if there's recti diastasis?
So you can do a little bit of a self-check at home. If you lie down flat on the floor, on a bed, if you put your fingers right into the center of your abdomen, that's where those muscles should connect, or pretty close to connect. So it's normal to have about one finger's width, where if you were to kind of sink your finger in, one finger would be able to fit in the center when you lift your head up. So what you do is you lie down, you just so slowly lift your head. And when you initiate that lifting of the head, that brings those muscles together. And you can feel if, number one, if there's doming, if there's this outward pushing at the center of the abdominal wall, we call it doming or coning, kind of like a pressure from behind the abdominals pushing out on a weak abdominal wall, that is an indicator that there is diastasis. Or if you can kind of fit your fingers in between more than one, so sometimes you can fit 2, 3, 4, or even more, that is indicating that the abdominal wall, the muscles are not close together, they're sitting far out. And it's sometimes they're far out when you check initially, and then as you lift your head more, they come together more. So it's a little bit hard to tell sometimes on yourself, although you can do a little self-check that way. But the other thing too is that there are some women who have a pretty significant separation as far as how many fingers they can get in there, but they are really, really able to generate strong, good tension when they bring those muscles together. And that's really what I'm looking for in the office, is not only how far apart are those muscles, but how effectively can they use that abdominal area.
Excellent, excellent. Next question. Is it unhealthy to hold the urine for a long time?
A good question. It can be, it can be. The bladder has a certain capacity to which it should fill. And if we are constantly pushing the bladder to hold more and more urine because we are delaying when we need to go to the bathroom, over time, that's not a great thing. So we see this a lot in teachers. We see this in medical professionals, people who can't just step out to go to the bathroom when they want to sometimes because they're attending to whatever they're doing. And sometimes over time, that bladder does get kind of more and more stretched out. And that is not a great thing to have happen. So yes, over time, that can be an issue. I see another question here. How long does the therapy take to stop bladder leakage? So that really depends. It varies tremendously from person to person. It also varies a lot depending on what kind of bladder leakage we're talking about. If we're talking about that stress incontinence or urge incontinence, and some people have both. And then also how long it's been going on for and kind of what the underlying reason is. There are some people who come into the office and they tell me from the time I was little, I was the one who was always rushing to the bathroom. And all my friends know that I, always know where the bathroom is. And if I'm not there, I'm going to leak. And this has been going on forever. And then there are other women who have recently had a baby. Maybe they tore during a vaginal birth and now those muscles are not working optimally, but it's kind of a newer issue. So it really depends on kind of the duration, exactly what's going on. But I always tell my patients, for the most part, when I'm treating in my office, within about 5 visits, 4 to 5 visits is what I usually say, we start to notice some change. There should be movement within a positive direction by about the 4th or 5th visit. And if for some reason we're not seeing that at that point, then that tells me either we're not going the right direction as far as what's really necessary to treat the problem, or there's something else underlying that hasn't been considered.
Excellent. So 4 to 5 visits is a threshold. Very good.
Yeah, and that's not to say that the problem is resolved at that point. I want to be clear about that. That's usually to say that we're seeing some positive change.
Excellent. Next question. Can muscles actually be brought back together years later without surgery, or is it a matter of strengthening the muscles?
So I think you're talking about rectus diastasis, and if I'm mistaken in thinking that, then please correct me. But if you're talking about diastasis, it doesn't really matter how far along after having had a baby or how long you've been dealing with the diastasis it is. With proper training and a lot of effort. This doesn't happen quickly and easily. There has to be a lot of effort, just like with any other kind of training. If you're going to the gym to try to get stronger, it doesn't happen from doing it once a week. And I always tell people in my office, you can come in to see me once a week or come in even twice, but if you're not doing it at home, it's really not going to have the effect that you're looking for. So yes, it doesn't matter if it's far out, if it's years, sometimes people say I had a baby, 8 years ago, 20 years ago, whatever it is. It's about learning how to use those muscles effectively.
We have someone agreeing here. Yep, I'm still working on it. Absolutely. Okay, another question is, how about those new electronic devices that are on the market now, attached to apps to help you strengthen your pelvic floor and muscles? Do you have an opinion on those?
Yeah, so there are a lot of different ones. I think that they have their place and they can be very helpful for some women, but I say that with caution because I think that oftentimes they're being marketed directly to the consumer, to the women who are using them. And then that's where we get into the issue of we're sitting down, we're doing Kegels, we're squeezing away, which may or may not be effective for the problem that you're trying to address, depending on what your pelvic floor is really doing. And there is no way to really know that, again, unless we're really checking. So I think that it gets a little bit confusing sometimes when women are just doing that at home. And it's also not so functional. So, it's one thing to sit down and do it, but that's not necessarily going to carry over to when you want to run or when you want to participate in your fitness class. So I think that they have their place. I think for some women to be able to localize these muscles and start to tap into how to use them in terms of like where they are. Some people have trouble even just initiating that contraction. So in those cases, I think it can be helpful, but I do say it with caution.
Okay. All right. Thank you for that.
Sure.
Next, we don't necessarily have a question, but more of a share. They are saying, I am currently a patient of Dr. Hirsch's. I sought care postpartum to ensure I returned to my exercise routine safely. I ultimately ended learning that my postpartum sexual experience didn't need to be what it was, vaginal scarring and episiotomy. I learned so much more about what I was tolerating versus what I could be enjoying, and I'm so glad I've had this opportunity to learn more about how to live comfortably and happily rather than just dealing with it. Absolutely.
Thank you.
That's wonderful. Same here. Dr. Hirsch has helped me so much. Thank you. And more thanks for sharing all of this wonderful information. One last question would be, how soon after birth should a woman seek physical therapy, pelvic physical therapy?
So the standard is generally 6 weeks. Once a woman goes back for that postpartum visit, then that's usually the green light. But there are times that women come in even before that, because even if we're not doing an internal exam before 6 weeks, which I wouldn't do until the doctor gives clearance, there are other things that we can start with. Some really simple exercises to start getting that abdominal wall to get used again, kind of remembering where those muscles are. Things in terms of how to safely get in and out of bed. And these are things that I teach during pregnancy and before delivery also, because there are things that are super, super relevant before having a baby and definitely after the case also. So it really depends, but I would say most women come in sometime after 6 weeks.
Excellent, excellent. Any final questions? We might be able to take one more before closing for the evening. I think we're good.
Thank you so much.
Thank you. A special thank you to Dr. Hirsch for that fabulous presentation. And also again to Yvette Leonard for joining us, and all of you for coming together on International Women's Day. This is a first for us, and we're just so pleased to be able to offer information, support to our community. So we invite you to feel free to email questions, feel free to contact Dr. Hirsch or Yvette Leonard directly, and we hope to see you again.
Thank you. Good night.
Good night, everyone. Have a great evening.
Thank you so much. Good night, everyone.
Thank you, Achi.
Thank you. Thank you so much. Will the video be posted?
Yes, I believe so. We are recording.
Awesome. Thank you so much. Very informative.
You're welcome. Thank you for joining us.
Bye.